Integrative Health of Orlando, where I help diabetics every day increase the quality of their life and help them to obtain and maintain their health by restoring function to the body. Now, I'm going to be seeing you in just a few days, but I wanted to uncover the truth of 3 very common diabetic myths. Okay, so myth number 1 is that a pancreas dysfunction is the primary cause of the disease. Now, it is very rare that a type 2 diabetic has a pancreas dysfunction, believe it or not. There are a lot of other components that are involved, a lot of other organ systems that are involved with blood sugar control beyond just the pancreas. Okay, myth number 2 is that the body needs more insulin. Okay, a very common misconception is that a diabetic is a diabetic and they need insulin to help control the blood sugar. This isn't true. If you're a type 1 diabetic, yes, insulin is the issue. However, for a type 2, it's not the insulin levels that are the main culprit. Basically, more likely than not, you've got more enough insulin that your body needs. Okay, myth number 3 is that the weight gain caused the diabetes. All right, this is another very common myth, that a lot of diabetics think that they have diabetes because they gained weight. Now, most diabetics actually gained weight because they had diabetes in the first place and they didn't even know it. Okay, so again, there's more to it. There's a lot of different causes of diabetes, and when we meet again, I'm going to be discussing diabetes from a completely different perspective than you've ever heard it discussed before. We're going to be discussing all of the different causes of diabetes and so much more. Now, please stay tuned for some words from past and current patients of mine who wish to share their experiences with you. I'll see you real soon. Take care.
I'm just here to let other patients know that since I started this treatment, I feel a whole lot better. Before, when I had my meals, I would get very sleepy. Currently, I feel a whole lot better. I've actually joined the gym. I've lost a good 25 pounds. And overall, I just feel great.
And how much insulin were you on?
And now I'm off the insulin, on both insulin, and I'm using no diabetes.
Your name?
Yep. My name is Mona. I started here about 6 months ago. When I first came, my blood sugars was out of control. And over the months, when I came down here and got onto the plan, I noticed that my sugars started leveling out. I was not craving sugar was another thing that I craved. And that the program here, I think, that helped me to realize there was more of an alternative to the one that they wanted me to have. They wanted me to go on insulin, and I did not want to go on insulin. And then now I find myself on glyceride 2.5, and sometimes I have to watch what I eat. But as far as another program, especially when you are diagnosed a diabetic and it's not working for you, and over the years you kind of feel like it's getting worse rather than better, and you don't want to go downhill. And I was fortunate that I saw this program on TV. I said, well, let me go down there. Maybe they think like I think. And fortunate for me, they learned me how to eat a different way, to watch what kind of foods I eat, and the vitamins, and the water. Now, what I have learned here will last me a lifetime. I'm so happy to come to the program. I would recommend it to anybody, that especially when you are adult set diabetic, meaning that you've never been a diabetic, and here it is, you're over 40, you've just been diagnosed with this disease, and they telling you that you gotta be on insulin and all that other stuff. There is an alternative to what is out there, and I'm so happy. Thank you so much.
That's how I felt at the beginning. I thought I'm Tom Johnson.
Yeah.
I'm the doubting Thomas. Okay, okay. I'm an anal person. Coming in, I thought, oh, this cannot be true.
Mm-hmm.
You know, you come in and you tell us what blood tests you're going to run, how much it's going to cost, what the program's going to cost, and I think this is just one of those gimmicks or schemes.
Mm-hmm.
And then you run the blood test, you give us the results, and then you start the treatment. And in my particular case, my insulin intake dropped quickly from 90 units a day to 60 units a day to 30 units a day. I'm no longer taking insulin at all.
Mm-hmm.
Dropped my pill medication in half,
Yeah.
and then came off of that for a while, and now I'm back on a pill only for a couple of days a week when my glucose levels are high at night when I get ready to go to bed. Other than that, I mean, I'm starting to refer people to this clinic. I mean, this is definitely a new approach to curing diabetes. I would recommend this to anybody.